My name is Vladimir. I come from Bulgaria. I'm a clinical psychologist trained in cognitive behavioral therapy. So basically, I'm working with clients there.
And my name is Lyubo. I'm a child and adolescent psychiatry resident from Sofia. I'm also doing training in systemic therapy right now. Yeah, we met at the airport. Actually, we didn't know each other prior to that.
It was strange. Actually, I recognized him because we were already in a group before the visit. So I recognized him at the airport, and that's how we met. It was quite an interesting experience, to be honest, because we both work in the same city in Bulgaria. We're both from Sofia, and we kind of have some connections there with other professionals, so we could get together very well. Mm-hmm.
Yeah, and he's a really smart guy, and he's doing evidence-based psychotherapy, which is, I think, rare in our country. Not that many people follow evidence. So I think we could work together. I would send patients to him if I find the case suitable.
I would say vice versa.
I think I made a friend also.
I would say, comparing to our culture and the way we work, the main highlight is the way they do promotion and prevention and the focus they put there. As back home, we do a lot of intervention, so it's a very interesting approach towards mental health, and I would take that as a good example to follow. Let's see if we can change something back home then.
Yes, I enjoyed the way they try to solve problems on a national level, working together as a nation, as a society. While in our country we are too individualistic, I think. We're not collaborating enough.
I managed to do a couple of discussions with some of the presenters. As I meet clients myself, I was able to discuss how they approach specific cases. I was very interested in one of the visits in one of the organizations where they spoke about women who used aggression at home in domestic violence, as well as young parents who face difficulties when bringing up their children. So we could actually exchange some ideas there.
I asked a lot of questions and tried to make comparisons to the way we work at home, and I got I guess I got some really good ideas what I can maybe do and go around and find what type of non-government organizations we have at home and how they work. Maybe try to meet people and create a network.
So we did try the traditional Finnish sauna, and I believe this is one of the most memorable experiences. I couldn't believe I could make it in water close to freezing temperature.
I didn't think I would survive, yes. But
that's why I let him enter first.
Yes, we went to an authentic Finnish sauna in Tampere. It was really a great experience.
Apart from that, we saw quite a few interesting cultural museums, and yeah, it was an interesting experience.
What I liked most about Helsinki was the library, because it's a very big building where the whole community can go and you can be around other people, just read a book or have a coffee, and it feels really nice. It creates this sense of community that influences mental health positively, I think.
I would recommend it because on the one hand, the cultural exchange is very useful. We meet professionals from other countries. We see how they work, what are their approaches, what methods they use. I personally got some assessment tools from other colleagues from other countries, and I believe I can implement back home. That's why I would recommend for others to also benefit.
I would also recommend it. I think in our daily lives we get stuck in our local ways of solving problems, and an exchange like this is a great opportunity to see other approaches and other ideas. And also, outside of the program, I met really inspiring people from the group, from the exchange group. Yeah, I would also definitely recommend.
I don't think there is an ideal way to approach this issue in general, but I believe a combination of what we saw here in terms of promotion and prevention, as they do a lot of early, so to speak, interventions in mental health in general, is a very good start, and then accompanied by specialized mental health assistance would be an optimistic view for the future.
Contrary to self-help books, I think solving mental health problems is not up to the individual, it's up to societies to support people in need and to create a place for everyone. So I think what we saw here is very close to that, or this direction. Maybe you can do this at home too.
if you allow me one more thing, I would add education as well, because I believe people get educated about mental health from early age, and something that we miss.